In our last video, we talked about the real reasons low back pain keeps coming back: tight muscles, weak core, stiff hips and ankles, and poor movement patterns. Today, we want to show you the 4 best exercises we give patients to start fixing those issues at home.
So these are simple, but if you do them consistently, they make a huge difference. Exercise number 1 is the cat-cow. First, we need to get motion into our back because when you sit all day or move poorly, everything gets stiff, and stiffness creates pressure. So you're going to be on your hands and knees, your hips over your knees, your shoulders over your wrist, and you're going to do a slow cat-cow where you're going 10 reps in each position. So you're going to drive your head down and arch your upper back all the way up, feeling a full stretch. And then you're going to slowly lower your belly button to the floor while bringing your head up to look at the ceiling in front of you. So again, you're going to do 10 slow reps in each direction, and this gets your spine moving and tells your nervous system it's okay to relax those tight back muscles. All right, exercise number 2 is going to be the kneeling hip extension. So with this one, you're obviously going to be down on one knee, one foot and forward, and you're going to press your hips forward, your knee over your toe, and you're going to squeeze the down leg glute. You're going to hold that for 5 seconds, and then you're going to release the tension, come back, and you're going to repeat that 5 times on each side, remembering to squeeze that glute on the down leg. You should feel a stretch in the front of the hip, and it should help kind of loosen the low back up since your hip flexor ties into your low back. This takes a ton of pressure off your lumbar spine, so when you walk, run, or stand, it should feel a little bit better. Our third exercise is going to be the dead bug. We need your core to actually do its job. A lot of people think they need ab workouts, but what they really need is spinal stability. So we're going to be laying on the floor for the dead bug. We're going to bring our knees up into the air so they're at 90 degrees and over our hips. We're going to brace our core and lower our ribs down and engage that core, and we're going to push our hands overhead into the box in this situation, or a wall if you have that at home. Then you are going to slowly lower one heel down to the ground, keeping that same 90-degree bend in your leg, touching the heel down and bringing it back up, and then alternating with the other side. You're going to do these nice and slow and controlled, 10 reps on each side. If your low back arches, that means you've lost your core brace. So you can take a little bit of a break and then come back and finish the set. The final exercise is a side plank with a clamshell. We have to get the glutes firing. Your glutes are supposed to be one of the biggest protectors of your low back. But if they're asleep from sitting too much, guess what works overtime? Your back. So here's how we do it. You're going to be laying on your side like you're getting ready to do a side plank with your knees bent and your feet stacked. You're going to slowly raise up into the side plank, push your hips forward, and then raise the top knee up in the air and really focus on squeezing the sides of the glutes. You should feel this mainly in your glutes and your hips, not in the low back. You're going to hold it for 5 seconds and then you'll go back down. And you're going to repeat this, doing 5 to 10 of those 5-second holds on each side.
These 4 exercises directly attack the biggest issues behind reoccurring low back pain: mobility restrictions, weak core muscles, and underactive glutes.
And for a lot of people, doing just these daily starts to calm things down fast.
But here's the truth: if your back pain keeps coming back, there's usually more going on. Tight adhesions in muscles or fascia, joint restrictions, or movement compensation. That's where we come in.
At Peak Performance, we figure out exactly what your body is compensating for and create a plan to actually fix it. Give us a call at 785-842-7325 and let's get you moving and feeling better so that you can get back to performing at your peak.